Hey, Dr. Lab family. Do you have numbness, burning, or tingling on the top of the foot? Have you ever experienced a strange, unsettling pain that feels like an electric shock, a burning sensation, or even pins and needles seemingly out of nowhere? It's a type of pain that can be incredibly debilitating, often described as a mystery because it doesn't always come from an obvious injury. Today, we're talking about neuropathic pain, what it is, why it happens, and most importantly, how we can approach managing this challenging condition. If you or someone you know struggles with this, stick around, because understanding is the first step towards relief. What exactly is neuropathic pain? Imagine your body's incredible electrical wiring system, your nerves. Now imagine if that wiring gets damaged or starts to malfunction. That's essentially what happens with neuropathic pain. It's a type of pain that stems directly from damage to the nerves themselves, or from a glitch in the way your nervous system processes pain signals. Unlike the sharp ache you feel when you stub your toe, neuropathic pain is often described as shooting, burning, stabbing, or even an intense pins and needles sensation. It can be constant and severe, or it might come and go, flaring up seemingly at random. The tricky part is that nerve damage doesn't just affect the injured spot. It can alter nerve function in areas all around it, creating widespread discomfort. A powerful, albeit rare example of this is phantom limb syndrome. This occurs when someone has had an arm or a leg amputated, yet their brain continues to receive agonizing pain messages from the nerves that once served the missing limb. These nerves, now without their original connection, misfire, sending false pain signals. The root causes. Why neuropathic pain develops. One of the frustrating aspects of neuropathic pain is that sometimes there's no clear single smoking gun for its onset. However, we do know that several conditions and factors can commonly trigger it. Chronic alcoholism. Long-term alcohol abuse can damage nerves. Amputation. As seen in phantom limb syndrome, the remaining nerves can cause pain. Chemotherapy. Certain chemotherapy drugs are known to have nerve-damaging side effects. Diabetes. High blood sugar levels over time are a very common cause of nerve damage. Diabetic neuropathy. Facial nerve problems. Conditions affecting nerves in the face, like trigeminal neuralgia, can cause intense pain. HIV infection or AIDS. The virus itself or treatments can lead to nerve damage. Multiple myeloma. This type of cancer can affect the nerves. Multiple sclerosis, MS. MS is a disease of the central nervous system that damages the protective coverings of nerves, leading to pain and other symptoms. Nerve or spinal cord compression. This can happen from conditions like herniated discs or arthritis in the spine, where bone spurs or bulging discs press on nerve roots. Shingles, postherpetic neuralgia. After a shingles outbreak, some people experience persistent, severe nerve pain in the affected area. Spine surgery. Sometimes, despite successful surgery, nerves can be irritated or damaged during the procedure, leading to chronic pain. Syphilis. In its later stages, this infection can cause nerve damage. Thyroid problems. Underactive or overactive thyroid conditions can sometimes contribute to neuropathic symptoms. Recognizing the signs. Symptoms of neuropathic pain. The symptoms of neuropathic pain can be quite distinct from typical pain. If you experience any of these, it's worth discussing with your doctor. Shooting, stabbing, or burning pain. Often described as electric shock-like sensations. Tingling and numbness. A sensation of pins and needles or a loss of feeling. Prickling sensations. Feeling like something is pricking your skin. Hypersensitivity, even light touch, cool air, or gentle pressure can feel intensely painful. Loss of balance or coordination, if motor nerves are affected. Diagnosing neuropathic pain is a comprehensive process. Your doctor will typically begin with a detailed interview asking you to describe your pain. How would you describe the feeling? When does it occur? Does anything specific trigger or worsen it? They'll also inquire about your medical history and any risk factors for neuropathic pain. A thorough physical examination is next, where your doctor will assess your reflexes, sensation, and muscle strength. To get a clearer picture, they may also request additional tests, such as to check for underlying conditions like diabetes or vitamin deficiencies. Nerve conduction studies, NCS, and electromyography, CHUS EMG tests, measure the electrical activity of your nerves and muscles to identify nerve damage or dysfunction. Imaging scans, MRI, CT scans, can help identify if there's any compression or structural issues affecting the nerves or spinal cord. Neuropathic pain can be notoriously difficult to treat, often responding poorly to standard pain medications. This is because it involves complex changes in the nervous system. However, there are many effective strategies, and a multidisciplinary approach often yields the best results. Often, your doctor will start with medications not traditionally used for pain, such as anticonvulsant drugs like gabapentin or pregabalin, or certain antidepressant drugs, like tricyclic antidepressants or SNRIs. These medications work by calming overactive nerve signals. NSAIDs, non-steroidal anti-inflammatory drugs. While less effective for pure nerve pain, some studies suggest that NSAIDs like Aleve, naproxen, or Motrin, ibuprofen, might offer some relief, especially if there's an inflammatory component. In some cases, stronger prescription painkillers may be necessary, but these are often used cautiously due to potential side effects and risks. It's crucial to have an open discussion with your doctor about the pros and cons of any medication. If another medical condition, such as diabetes or a thyroid problem, is contributing to your neuropathic pain, better management of that disorder is absolutely vital. Effectively controlling the underlying condition can not only alleviate the pain but also help prevent further nerve damage from occurring. For individuals whose neuropathic pain is severe and unresponsive to conventional treatments, a pain specialist might explore more advanced options. Electrical stimulation devices. These invasive or implantable devices can deliver mild electrical impulses to the nerves involved in the pain, significantly controlling symptoms. Examples include spinal cord stimulators or peripheral nerve stimulators. Nerve blocks. Injections of local anesthetics or steroids near the affected nerves can temporarily block pain signals. Beyond medication, a holistic approach can provide significant support and relief. Physical therapy. Specialized exercises can help improve strength, flexibility, balance, and overall function, retraining your body to move without exacerbating nerve pain. Working with a counselor therapist. Living with chronic pain takes a huge emotional toll. Counseling can provide coping strategies, address anxiety and depression, and improve your mental resilience. Relaxation therapy. Techniques like deep breathing, meditation, and mindfulness can help reduce stress, which often amplifies pain. Massage therapy. Gentle massage can help improve circulation, reduce muscle tension, and provide comfort. Acupuncture. This ancient practice involves inserting thin needles into specific points on the body and has shown promise for pain relief in some individuals. Unfortunately, it's true that neuropathic pain can be stubborn, sometimes responding poorly to standard treatments or even worsening over time for some people, potentially leading to significant disability. However, the key takeaway is that a multidisciplinary approach, combining medical treatments with therapies, lifestyle adjustments, and emotional support, offers the most effective pathway to finding relief and improving your quality of life. Don't give up hope. Neuropathic pain can feel isolating and complex, but as we've seen today, there are many avenues for understanding and managing it. Remember, open communication with your healthcare team is paramount. If you're experiencing these symptoms, don't hesitate to seek a proper diagnosis and explore a comprehensive treatment plan that's tailored to you. Your journey to feeling better is a process, but with the right approach, relief is possible. What's your biggest takeaway from our discussion on neuropathic pain? Share your thoughts or experiences in the comments below. And if this video brought you clarity or hope, please give it a thumbs up, subscribe to Health Protocol, and hit that notification bell so you never miss out on vital health insights. We're here to empower your health journey, one step at a time.